Welcome everybody, good afternoon. Thank you for listening and watching, and thank you for your patience over the past few days. It's greatly appreciated. Now today it's myself as Chair of the Civil Contingency Authority and Dr. Brink. And Dr. Brink's had a great personal day today as her son graduated with a first-class degree, master's degree from Cardiff University in Engineering. So congratulations to him. And thanks to her for coming here this afternoon when she's had that personal family occasion. Excellent news. In relation to the CCA, now we know that the last week or so has been difficult. We appreciate that. We're sorry for any inconvenience. We're genuinely sorry. Each and every member of the authority is sorry. That's the political members. We're the ones that need to make an apology and nobody else. Now, of course, when you're making decisions, you make them on the best information you have at the time. They're not always perfect because they're a matter of judgment. And if things are wrong or we need to change direction soon or quickly, we'll do so. And this is an example of where we've done exactly that. Now, we're grateful for the community's understanding because we do continually review our decisions, and we've listened to the overwhelming concerns of the people of the bailiwick. And that's one of the reasons we made the change of decision on Monday. But just a week is, they say, a long time in politics, and a week is a long time in the life of the CCA, because just looking back a week, we were faced with rising prevalence levels in our neighbours. We were concerned about the variants. We were concerned about the community seeding cases we had both in Alderney and Guernsey. And we were also examining the evidence of travel volumes and patterns in other areas. And also, we'd done some research, as best we could, in relation to facilities being available in the UK for testing. And we did all of that. And just to show that it wasn't a decision that was made in the blink of an eye, the States met last Wednesday, Thursday, Friday, and was fully busy. We, as the Civil Contingency Authority, met Wednesday lunchtime, we met Thursday lunchtime, we met Friday morning, and then we came to the conclusion and the decision that we announced at lunchtime on Friday. The decision that we took was done in the best interests of our community, and it was done by experienced politicians. I first entered the States in 1994. Deputy Lindsay de Summer is in her second term in the States and is President of Environment and Infrastructure. Deputy Rob Prow is President of Home Affairs, considerable experience in border agency matters, and again in his second term in politics. Deputy Al Brewer has been in politics a long time, President of the Health Committee. And also last week, of course, we had the assistance of our advisor, Deputy Heidi Salisbury. We also had the senior politician available in Alderney, Mr Bill Abel, and the senior politician in Sark, Senator John Gill. So we chewed over the matter considerably. But, as I say, we listened. We listened to the concerns of the public as expressed over the weekends, and of course the change of circumstances. And it was clear that the difficulties, for example, in pre-travel testing in the UK was such that I had emails, and I'm sure I'm not the only one, that said, look, I've tried to get arrange for pre-travel tests in the UK, but I'm not in a main conurbation, I'm not near an airport, I can't get one, or I've had one and it's cancelled. We took all of those considerations into account, and so we listened. We were in contact with each other over the weekend, we reviewed the decision, we met on Monday, we made the announcement on Monday that we were going to overturn the decision for people to have to pre-travel test, so that therefore the Thursday date was set aside. We met again on Tuesday, and then we quickly made the announcement yesterday afternoon about what we were going to do. Now, what we're going to do, and this is effective from next Tuesday, the 3rd of August, we're introducing lateral flow tests on arrival for adult blue channelers. And that means people travelling from within the common travel area who've had their 2 jabs plus the 14 days thereafter. Those people will be charged £25 for a pack of 5 lateral flow tests. Payment is a condition of the travel, and it will be paid when you fill in your travel tracker. If you don't pay it, then you'll be classified not as a blue channeller, and you will have to revert to what other isolation testing regime is appropriate for the areas that you've come from. The pack will be handed to blue channel travellers on arrival, and it's all done by our already busy welcome team. Now, I'm sure everybody will treat them with courtesy because they're doing their best, they're already busy, and they're there to assist you. We're asking travellers to take their first test, whether either they go home or to their hotel accommodation or wherever, and then to test every other day. We trust the community of the people of Bailiwick of Guernsey to do what is appropriate. We know they will. They've done so before because they want to protect themselves, their families, and our community. Now, you don't have to report negative results, but anyone who gets a positive test must immediately self-isolate and contact the clinical helpline to book a PCR test. Children aged 11 and under travelling with fully vaccinated adults obviously are not going to be tested with a lateral flow test. Young people aged between 12 and 17 will, as per now, receive and have a PCR test on arrival and on day 7. We are strongly recommending to those who are visiting our islands for their holidays, we welcome them, we're glad they're here and will be coming here, that they should have a pre-travel test. The reason for that is if they fall ill, they're best to be at home rather than in a hotel for 2 weeks in Guernsey. That'll protect them, protect their families, it'll protect our community. Now, we're aware of the feedback, particularly from visitors, frustrated that they simply cannot bring their own lateral flow tests. Well, there's a number of reasons why we're not allowing that. We need to ensure consistency. That's to say that all Blue Channel travellers receive the same tests and have the same amount. We're not receiving these tests for free, by the way. Although we do receive larger packs of lateral flow tests for free through the NHS supply chain, those are specifically for surveillance testing for staff in our critical sectors. Our policy decision, and it is a policy decision, to provide lateral flow tests for fully vaccinated on arrival, is outside of this, and the Guernsey taxpayer is paying for them, and they're not cheap. As such, we believe it's appropriate thus to levy a charge. The £25 per fully vaccinated adult is a condition of travel. We don't believe it's unreasonable. We don't believe that it is something that people can't afford, and we do insist upon its payment. Now, Dr. Brink will touch upon this further and more ably and more eloquently than me, but we have all to embrace living responsibly with COVID, and that means also travelling responsibility with COVID. Even when we're fully vaccinated, everybody's fully vaccinated that can be fully vaccinated, travelling is not risk-free. When we make a decision to travel, which is perfectly acceptable, we're not meant to be trapped on this island forever, and we want to welcome people to come here, it's an individual's decision that people make, and with that there is a potential for you to contract COVID while away. Just as we advise people visiting the bailiwick they must be aware that they have to follow our laws and isolate if they test positive while they're here, equally it's a fact that local residents must consider that when they're in a jurisdiction other than Guernsey, they will be subject to the rules of the jurisdiction that they're in. So everybody wanting to travel needs to take into account the risk that they have, which is that they may have to isolate if they contract the virus. We hope they don't contract the virus, but, you know, it happens. Just before I hand over to Dr. Brink, I would again like to emphasise that we're sorry for the inconvenience that was caused. It was a political decision. We reversed it as soon as we believed that there were other options available. And again, I hope everybody enjoys their summer. We will be meeting again regularly at the Civil Contingency Authority. We've other business to continue, but the decision that I've just announced will be one that we'll be following through for the foreseeable future. Dr. Brink.
Thank you. So thank you very much, Deputy Fairbrush. And I would like to echo the comments that Deputy Fairbrush made about living with COVID. So living with COVID means that we will see COVID cases. We are prepared for COVID cases. It forms part of our planning. We're going to see individual cases, and indeed we're going to see clusters of cases. We can see outbreaks like we saw in both Alderney and in Guernsey as well. We're prepared for them and we'll manage them. We may also see a wave of infection. So that all is part of our forward planning. But we're not going to live in an island, live in a bailiwick that is free of COVID-19. So as our population becomes increasingly vaccinated, we are protecting the most vulnerable in our society. And indeed, when I was looking at the vaccination figures, when I looked at them today, 82% of our 18s and overs, so our adult population, are now double vaccinated. That means we have one of the most advanced vaccination programs in the world. We know that another 13% have had one dose, so that puts us into the 90% of the 18s and overs that have at least one dose of vaccine. Now, that's incredibly important because vaccines do protect against, or provide protection against, people becoming severely unwell and hospitalisation. I'm going to show you a diagram which we've modified from an article in the Financial Times, which I think illustrates it very, very well later on. So living with COVID means that we'll see all of those scenarios. As a population, we need to prepare. We need to think how we can keep ourselves healthy. But the public health services, the states of Guernsey, are all preparing for similar scenarios. Another question I've had quite often is why are so many, how many fully vaccinated cases do we have? So if we look at all of our post-second wave cases that we have, which is over 100, is 40% of post-second wave cases occurred in fully vaccinated individuals. 60% were either partially or unvaccinated. That's not surprising. As our population becomes increasingly vaccinated, we will see more cases in vaccinated individuals. And if you then look at the diagram, and I understand that this is quite a busy diagram, but what this shows, I think, really well is actually what I'm talking about. So if you take a population of 1 million people, and 92% of those people are fully vaccinated, so of those, that will mean that 920,000 people were fully vaccinated and 80 people were not fully vaccinated. So then you superimpose on that the chance of someone getting COVID. So concentrate on the blue column on the right. So the chance of someone getting COVID, if they're fully vaccinated, if they weren't fully vaccinated, would be about 2%. So you then superimpose the vaccine efficacy on that. So if we put all of that together, we then got 3,680 people who are infected with COVID. So we then go on and look at the chance of being hospitalized. So you then look at the effect of the vaccination in reducing your chance of being hospitalized. And if you put all of that together, you'll end up with 110 people admitted to hospital. So if we compare that to our unvaccinated population, so we're looking there at 80,000 people, and using the same algorithm that I've just described, we would expect 1,600 people to become infected with COVID. So the fully vaccinated, we expect 3,680 people to be infected. The partial non-vaccinated, 1,600 to be infected. But, and this is where we start seeing the impact of vaccination, is of those that are admitted to hospital in the fully vaccinated group, you're looking at 110 people. In the unvaccinated group, 160 people. So of that cohort of 80,000 unvaccinated people, you will end up with 160 people in hospital. In contrast to that, of the cohort of 920,000 fully vaccinated people, would end up with 110 people in hospital. And I think that illustrates it really well, is that we are going to see cases in vaccinated people, we are going to see hospitalizations. That doesn't mean the vaccination program is failing. And I think putting it like that illustrates that point really clearly. Now, if we go on and talk about our testing strategy, and I wanted to pause a little bit today on our symptomatic testing. And there's been some interesting information coming out of the Zoe app. So the Zoe app is, of course, the research done by King's College Hospital. And if you go on the Zoe app, what they're reporting, interestingly, is in double vaccinated people who get COVID, sneezing is a very prominent symptom. Now, that's quite important for us because we're in hay fever season, so we've just got to be very vigilant. So they're talking about sneezing, headache, runny nose, sore throat. So again, completely different to what we saw in the first wave. I can remember sitting in front of all of you in the first wave, and it was fever, cough, shortness of breath, all of those symptoms. Those are not prominent in the Delta app, particularly in the Delta virus, particularly in the fully vaccinated population. Those symptoms are coming way down on the symptom list. So again, what we'd encourage islanders to do is, with those symptoms, is think about it. Don't think, oh, I've just got a bit of a cold. Do come forward and get testing, because you are helping your community by doing that. We've used surge testing quite a bit over the last couple of weeks. I've spoken to you about that. We've used it in Alderney, we've used it in Guernsey. We've completed that surge testing, and indeed it did identify more cases for us, so it really was useful. The surveillance testing programs are ongoing, and really the lateral flow testing at the borders just extends our surveillance program and looks at how we can just broaden the protection of our community. Now, this is particularly important as we become fully vaccinated. And I'm going to talk to you in the next slide about test choice, so I'll come back to that. The surveillance program, we're still looking at the sewage testing. And we've got some information through on this week, which we want to try and progress. And sequencing, we will be operational doing our own on-island sequencing at the end of this month. So that forms all part of our testing program. But I wanted to pause today and talk about the two different test types and where we use them, because I think that's quite important. So there's no doubt about it. For symptomatic people, the gold standard of testing is a PCR test. And so we'd always use that. So when people phone the clinical helpline, they're not going to be getting a lateral flow. They'll get a PCR test. In our hands, we have two different assays. We use our frontline assay, which detects 2 targets of the genome, and our confirmatory assay, which again detects 2 different targets. Testing of contacts of cases we'll use PCR for as well at the moment. We might look at different strategies in the future. And of course, in our unvaccinated individuals coming in through our categorization, we intend to retain PCR for that group. Some of our surveillance testing, we use PCR, not a lot, we use mostly lateral flow, but in some certain critical settings, we'd prefer to use a PCR test. And of course, we've used it for our surge testing. Now, when we were talking about border testing and the testing of vaccinated people post-arrival, one of the things we gave very careful consideration was, what does a test result mean? So in a fully vaccinated person, what you can get is you can get what we'd call an abortive infection. So a fully vaccinated person can come into contact with SARS-CoV-2, the virus that causes COVID-19, and what you can get is a really minor infection, low level of virus. That person is very unlikely to transmit. So what you don't want to do is do a PCR assay on everyone who's vaccinated as they come in the border and detect this incredibly low levels of virus, where you then have a positive result, but you know that this person almost certainly won't transmit. So in other words, they're infected, but they're not necessarily infectious. And whenever we put in a restriction, we need to consider the proportionality of it. So take the contrast to that is the lateral flow. So the lateral flow assays are detecting viral antigens, they're detecting viral proteins, they're detecting part of the virus. They are a less sensitive assay, absolutely, but they'll detect virus at levels, because if someone's lateral flow positive, we would be concerned about them transmitting infection. So it's to find the clinically relevant assay, which will give us the most, or answer the questions we're asking. And again, similar with surveillance testing. The other advantage of doing lateral flow assays in a sequential way is that you're doing it over a period of a week. It's not just a single point in time. And so I think the combination of those two, together with the convenience for people, they can take it home, they can administer it themselves. I trust the bailiwick population. I think they have been magnificent in their response. I think they've worked together, and I think we'll continue working together because we all want to move out of this pandemic in as safe a way as we can. So thank you very much.
Well, thank you, and thank you very much indeed, Dr. Brink. Now, I just did some mental arithmetic, and it's probably wrong, but I did some mental arithmetic on Dr. Brink's very busy slide. Now, she said 920,000 people who'd had both vaccines would have 110. You go to hospital on average, 80,160 if you were partly or unvaccinated. So I divided 920 by 80, and I think it was something like 11.5. Multiplied 160 by 11.5. That meant if you had the equivalent number, let's say you had 920,000 people who were not vaccinated or partly vaccinated, you would have 1,840 of those going to hospital. 1,840 as against 110. So that really does show the value of being fully vaccinated. And can I say to those good people of Guernsey and the other islands that have not yet been vaccinated, that have the opportunity of so to do, please do so. We appreciate you've got other things. It is summer and you've got busy lives, but please get vaccinated. You've seen the beauty and the benefit of being vaccinated. But now it's time for questions, and I wonder what we're going to get asked. Yes, please.
Hello, Louisa from ITV. You were talking a little bit about the different types of testing. Why is it that travellers coming from Jersey need to get a PCR test when others can just get lateral flow if they're coming from the country?
Well, I'll come to Dr. Brink in a moment, but if you remember, we made that decision before. We're reviewing that again. We have lots of CCA meetings because it is a matter of continual interest and concern to us. We're considering that again on Friday. It doesn't mean we'll necessarily change it on Friday, but Dr. Brink, I think you can add to that.
So absolutely, I think we review these decisions as they occur and as we progress. So we're looking at that actively, and we're doing some modelling on that today.
Next question, please.
Matthew Leach, the Bailiwick Express. One of the island's largest hotel groups has said today that continued changes to border restrictions are impossible to work with and is concerned that tourists are losing confidence in state's messaging. What reassurances can be given to the hospitality industry?
Well, I think what we've got to look at, because remember there was a significant number of our population, indeed some senior politicians of the past, said that we shouldn't open up on the 1st of July. We decided to open on the 1st of July. There was a slight variation about children, etc., from our blueprint that we published some time ago. We made the decision that we made last Friday, and I've explained how that was made and why that was unmade. Nobody can give a cast iron guarantee when you've got something in relation to COVID, but we very much believe that there will not be any significant adverse changes in the foreseeable future. So I think that's the assurance we can give to them. We would like to open up the borders more and as soon as it can be, but I think that the decision we've made and just announced is a matter that the hospitality sector can live with and still continue with their business.
John Fernandez from BBC Guernsey. One of the things in your release earlier this week was that you're waiting for the necessary testing packs to arrive in the anticipated timeframe. If they don't arrive in the anticipated timeframe, what are the options in front of you, Deputy Fairbrush?
Well, we're pretty confident. You could never have a guarantee until they're here. We're pretty confident. We said this will be effective from the 3rd of August. If the ship or the plane that brings them suddenly can't get here, then we'd have to change that because we've got to be realistic. Nothing's certain in life, or not many things are certain in life. We're pretty confident that it'll be all right and they'll be here and we'll be able to operate from next Tuesday. Sorry, Dr. Brigg, yes.
So just the other thing is that it's never going to be one measure. So as ever, it's a suite of protections. So things like coming forward and testing, and I'm sorry I go on and on about that. If you're symptomatic, come forward and be tested. And that working together as a community is so important. So it's the whole package. It's washing your hands, it's staying at home if you're unwell, it's getting tested, it's all of that together.
Yeah, good afternoon. My name is Will Green. I'm from the Guernsey Press. Is this the new normal, testing every time we come back, even for a day trip, and paying £25 to do that? Will lateral flow testing, the other testing requirements remain in place the rest of 2021? And will the CCA remain active for 2021 and into 2022?
Well, let me deal with the CCA point because that's a political matter. We would love to discharge our duties, but we can't do a Pontius Pilate. We can't wash our hands and walk away. Well, we should always wash our hands, but we shouldn't walk away from the responsibilities that we have. We can only act, we only got powers to act if there's an emergency or a likelihood of an emergency, etc., etc. I can't guarantee, I doubt that we'll be exercising our powers beyond the next few months, but I cannot say that. It will depend on the circumstances. As to lateral flow and the like, I think that's going to be with us for some time, but hopefully not forever. But Dr. Brink will be able to update you in relation to that.
So as ever, what we'll do is we'll have a look at the programme, we'll evaluate it, we'll look at the efficacy of it, and we may or may not continue with it. But I think once we are fully vaccinated, we have then done everything we can from a pharmaceutical point of view to protect the adults in our population who wish to be vaccinated, and we've got to work out how we then live and genuinely not just give lip service to living, but how we actually live in a COVID world, because that's what we've got for the foreseeable future. And I think we'll look at when we're fully vaccinated, we'll reassess the border policy with regard to the testing and indeed other aspects of the border policy. So nothing is there for forevermore. Everything will be reviewed at least every 4 weeks, usually every 2 weeks.
It sounds quite hopeful, actually, that sooner rather than later in the span of time that these things may gently sort of wash away, maybe.
Yes, I think what we've got to do, but we've got to look at how we take personal responsibility. But yes, I think what we're doing is we're moving away from a legislative framework for managing the COVID pandemic and moving towards one where every single bailiwick citizen takes personal responsibility for how they manage COVID for themselves. And I think that is of fundamental importance. And I think what we, as I said on my first slide, we have to accept. We're going to see cases, we're going to see clusters of cases, we're going to see outbreaks, and we will manage them as they occur.
Yeah, next question, Matthew.
Thank you. How many lateral flow tests have you bought and at what cost?
We bought 40, I may be wrong because I was told by our very able civil servants, I think we bought 40,000 and we're going to be buying another 100,000, 125,000. The cost is over £17 each, but of course on top of that there's all the administration charges, etc., etc. So it is a big, big cost to the Bailiwick of Guernsey, but it's money extremely well spent.
One of the questions that we've got a lot at BBC Guernsey is, and you addressed that consistency was one of the reasons why you can't bring your own test from the NHS. Yeah. Can you just run me through the other reasons? You said there were quite a few reasons why, but we only heard that consistency was the main reason. But why can't these tests work?
Do you want to add anything?
So, from our perspective, it simply is that people get the same test as they come in. They get a pack of 5, so it gives a consistent border policy that we're not giving out to one. Not, it is just to have a streamlined policy. And we've also had some questions, and I know is why don't people do the first test at the border? And that's simply not practical. And indeed, I don't think it would be safe for people if we corral a whole flight of people, get them to swab themselves and wait for half an hour while the test develops. I just don't think that's feasible, and I don't think that's right. People have just come off the plane, they'll be tired, that type of thing. So I think taking them home and testing them is the right thing to do.
Yeah, we just heard today about the UK allowing people from the US and the EU coming in from amber countries if they're fully vaccinated. Are you concerned about the kind of knock-on effect that could have here?
Well, we're looking at that because, again, it's an announcement that came as a bit of a surprise to us because our officials have been in regular discussion. They speak every week to their equivalents in the UK. We were expecting this kind of announcement perhaps on the 16th of August with effect from the 23rd of August. It's now coming in, I think, at 4 a.m. on the 2nd of August. So we're looking at that. And we will make a decision. It may not be the same as the UK. We're considering that again on Friday. We're doing a lot on Friday. We're considering that again on Friday, and we'll make a decision, an announcement, probably Friday or Monday.
One for you, Deputy Fairbrushe. How badly do you think the reputation of this CCA has been affected by the flip-flopping over the last week?
Well, I don't agree with the phrase flip-flopping. I know journalists like to use emotive language, and I don't blame them because there's lots of words in the English language and you use which ones ever fit you in the circumstances. I've done that for nearly 50 years as a lawyer, so I can appreciate journalists doing it. I think, no credit to me, but I think that in relation to it, we've shown that we listen and that we can act quickly if circumstances change, and they do change quickly. So I would hope that the intelligent people, of which that's the overwhelming number of the people of the Bailiwick of Guernsey, will realise that we've made the right decision. There'll always be the odd keyboard warrior. They will always criticise us whatever we do. But certainly I can say, because over the weekend, I, and I'm sure my colleagues as well, got lots of emails, and not only from the usual people that criticise you if you breathe, but lots of intelligent, decent people and people that I knew as well saying, I don't think you've got it right, because we listened to that, we evaluated the consideration, and I think most people have reacted positively to the fact that we've made a change, and we haven't made it in relation to pressure from the public. We've made it because we believe it's the right decision to do on the facts before us. Yes, Will.
I understand that some people are under surveillance testing at the moment as well. Will those lateral flow tests be required to be taken by them as well if they're travelling?
So we'd be looking at, they're very individualised, so we'd be looking at all of our surveillance programmes. They're cohorts of individuals, and we'll work with those individuals to standardise. So we wouldn't expect them to do their surveillance programme for their work plus a travel one. That would make absolutely no sense at all. And those people, we've already chatted to some of them, and it's just a sensible solution in that whatever the testing strategy is if you're testing every second day anyway for your work, it makes no sense to do an every second day for your travel as well, is that we'll just synchronise those.
Could I just check as well, in terms of the purchase of the packs, if you went for a day trip, say to the UK, you would still require the...
You'd have to pay. We've got to look at the administration costs as well, and the fact that, as we said, the welcome people, the greeting people, it would become administratively impossible to say, well, I'm only going for 3 days, can I just have 2, or whatever it may be. So it's going to be a pack of 5, and £25 is reasonable. It sounds like me, I'm at a supermarket really, 2 for 1, but it is administratively impossible or impractical, I should say, to do something different. Can I just add in relation to John's, because I think I should say this. I was talking about emails I'd had over the weekend. I normally reply to just about every email I get. I didn't. I've replied to some. They were so voluminous that I didn't have the chance. I'd have been doing it. And I've got to type them myself, so I'm not the greatest typist. So I'd like to say to those that I haven't replied to, it's not out of discourtesy. It was simply the time wasn't there. But hopefully they've now got the answer anyway to the majority of their emails. If anybody still feels aggrieved, write to me and I'll reply to when I can. Sorry about that. Next question.
Thank you. The briefing on Friday indicated, and as you spoke today, that we needed to change quickly, our guidance quickly, to deteriorating situations elsewhere.
Yep.
What are the ramifications of waiting more than 10 days, I suppose, until the 3rd of August before enacting any changes?
Well,
Can we risk that?
We've only announced a decision yesterday. We've got to make sure we've got the lateral flow tests. We've ordered them. John Fernandez covered that in one of his questions earlier. They're on their way, but we can't implement this new policy till we have these packs of 5, or at least they'll be individuals, I think, initially, but they'll be handed out in 5s and then they'll come in packs of 5s later. So we can't implement the policy till we have the relevant number of lateral flow tests in the bailiwick. Yes, Will.
How tough is it making these sort of decisions? I imagine that you don't always agree with each other. There may be different
We're not allowed to
opinions.
say that because
How difficult is it? Is it a lot of sleepless nights? You know, it must be an incredibly tense, stressful situation.
Well, I don't think anybody likes. Well, I know. I know nobody likes making decisions that are restricting people's personal liberty, and that's what the CCA in its various compositions has had to do over the last 18 months or so. It's hateful. I mean, who wants to tell people they can't travel? Who wants to tell people if they do travel, it's going to cost them £25 for this? Nobody likes doing that. Stressful. Well, I've been an education lawyer all my life, so I don't particularly find it stressful, but I do find it difficult to make the decisions, and I know that my colleagues do as well. It's not an easy thing, and we honestly always do what we think are the best interests of the people of the bailiwick.
One of the lines from the announcement earlier this week was that the vaccination programme is slower than was projected. Why is that?
So we think it's a combination of things. One thing is I think some people just weren't getting round to making their vaccination appointments. I honestly don't think it was deliberate. You know, I think it was just we haven't quite got round to doing it. So if you leave it for a week or 2 weeks, it then shifts the program backwards. So what we've done is we're trying to explore ways in which we can make the vaccination program accessible for people who maybe don't want to be tied down to a fixed period of time. So we've started our walk-in clinics, which we've been doing walk-in vaccination appointments, so that people can just walk in and have their vaccination. So it's a combination of all of those. We're also going to be bringing the vaccination interval down. Now, we've always had a shorter interval, which is why our vaccination program has been slightly ahead. But we're going to bring it down a little bit more. So with Moderna, it's 4 weeks, but we're planning to bring the Pfizer-BioNTech down to 3 weeks to enable us to get everyone vaccinated as soon as possible. Now, this is also relevant because we've got some students going to university, and I was told by a student, I've no idea if it's true, but they'll only be allowed to attend lectures if they're double vaccinated. No idea if that's true or not, but that was a concern raised to me verbally by a student. So what we're doing is we're trying to have a look at all of these and get people vaccinated as soon as we can. So to answer your question, it was probably a combination of probably mainly due to people just not making their appointments and maybe letting it drift for a week or two.
Anybody else with a question?
Just one last one from me. The decision on Friday, you mentioned about how decisions that you've come to earlier had the full support of STAC, this body which advises the CCA.
Yeah.
Did the decision on Friday that you rolled back on have the full backing of STAC?
No, I don't think we had the chance to, because it was a rolling programme, as I explained, Wednesday, Thursday, Friday. I don't think STACs were due to meet again until this Tuesday, and therefore we made the decision without having the imprimatur of STACs, because we felt it was necessary to make that decision. I don't know if there's anything you want to add, Dr. Green.
So, I mean, from STAC's point of view is that they met on Tuesday this week, and this was a decision that was independent of STAC.
Anything else for anybody? Okay, well, thank you, everybody, for their questions. Thank you very much. And by the way, there's much to enjoy in Guernsey all the time, of course. I've got a programme, somebody's given me a programme from the Roquet Regatta, so I hope people are going to go to that in their thousands over the weekend. It's a splendid occasion. It's going to have good weather. And, of course, it's one of the iconic events of Guernsey. But there are many other things to enjoy in the Bailiwick. Enjoy them, and we'll be with you again soon. Thank you very much.